Hello, I'm Mayor Jim Langfelder, and I would like to take this opportunity to address the residents of Springfield. I'm joined tonight by our Springfield Fire Chief, Alan Rainey, and Springfield Police Chief, Kenny Winslow. Like many of you, I have watched the global, national, and now state-level news reports and briefings regarding the spread and impact of the coronavirus, commonly known as COVID-19. This challenge is something we have never experienced in our lifetime. In just 1 week, we went from questions of an Amtrak customer to celebrating 2 local teams vying for the state championship in front of standing room only crowds, to gatherings of 250 people or less being requested, to shuttering schools, restaurants, and bars. This situation has changed and evolved rapidly each and every day. This means that each day my directors, our employees, and our first responders do their best to adjust and pivot to any changes and announcements made at the national and state levels. This new normal we are entering is a first-of-a-kind situation. It may be frightening, but I am asking that we keep calm and take reasonable, disciplined steps to protect our community. I need to emphasize to you that this is a public health crisis, and the lead agency for our areas is the Sangamon County Department of Public Health. They are our source for information and report directly to the State of Illinois Department of Public Health. These are the entities we receive our data and updates from each evening. To ensure our residents' health and safety remain at the forefront of this pandemic, I appointed Fire Chief Alan Rainey as the Springfield COVID-19 coordinator. He has a specialized training and experience to handle this unprecedented emergency. In a time of crisis, we need to look to the experts in their respective fields. The Springfield Fire Department is a Class 1 rated fire department. Only 3% of the fire departments in the United States have achieved this ranking. This is not a time for politics. It is a time for health and wellness of our residents. And our first responders are the first point of contact with our neighbors each and every day. In times like this, government is expected to provide whatever assistance and information we can. With the dramatic and rapid changes, the city government is taking the necessary steps to recommend public health guidelines while still providing essential services for our residents. It is important that we provide the services the public needs and deserves while keeping our workforce safe. That is why I made the difficult decision to close the Municipal Center complex and Lincoln Library to walk-in traffic. City staff is still available to answer your questions, provide guidance, and if necessary, be available for appointments. We encourage residents to call our main number, 217-789-2000, before coming to City Hall. This is for everyone's safety. Other changes we have made to help our residents. City Water, Light, and Power has suspended all disconnections until May 1st, 2020. At such time, it will be reevaluated. Administrative court has been canceled until further notice, and downtown parking meters will not be enforced at this time. To keep our first responders safe, the city set up a hotline for residents to self-report your household exposure to COVID-19. Similar to Crime Stoppers, you do not have to provide your name. We simply are looking for your address so our first responders will know what to wear as appropriate levels of protection when responding to emergencies in your neighborhood. To self-report your address, please call 217-789-2464. I encourage residents to visit our website at www.springfield.il.us daily for up-to-date information related to city operations and access to resources and services offered in our community for individuals, families, and businesses. We will also be providing video updates to the community that will include information from city personnel, including our fire and police chiefs. You may submit your questions via email to feedback@springfield.il.us or by calling the mayor's office at 217-789-2200. We ask everyone to please follow the CDC and our state and local health department's guidelines. Stay at home whenever possible. If you need to go out, keep 6 feet of space between yourself and others. Wash and sanitize your hands often. Before I conclude, I would like to take a moment to thank our first responders and our medical community. To the staff and leadership of HSHS St. John's Hospital, Memorial Medical Services, SIU Medicine, and Springfield Clinic, you are second to none. Like our first responders, we will never be able to thank you and your family enough for the sacrifices you are making to help us through this health crisis. Together, we will get through this. The task I have for my directors is to make today better than yesterday and make tomorrow better than today. Springfield is strong, but I know we are stronger together. Thank you, Springfield, for your cooperation and partnership during this time. We will get through this together. And now I'd like to introduce Chief Alan Rainey to give us an update of where we are at this time.
For the Springfield Fire Department, this has been a real challenge. This is something that we've never faced before. And part of that challenge is we can't call for help from other places. Normally, when you have something like a tornado or other crisis in your community, you can call the communities around. We've been there for them. They will be here for us. But this is a challenge like no other because we're all in this together. This goes from Washington State to Washington, D.C. and around the world. So that's what's been the real challenge for our members. So the steps we've taken to protect them and the public is we have modified our response slightly. So we're asking additional questions when the dispatchers are asking additional questions when you call 911, just to protect our responders and make sure that we are doing everything we can to flatten that curve to not spread this virus around. The other thing, you might notice that the responders are dressed a little differently. They're still the same people, they're still the same caring individuals, but based on that information received by dispatch, there are times where they may have to dress up in a little bit more of what we call PPE, personal protective equipment. And that personal protective equipment, and that PPE is limited. And that's one of my worries as the fire chief, is to try to make sure that we are keeping our responders safe and that they are keeping the public safe. We have, in a cooperative effort with Sangamon County Public Health and Sangamon County, we have started an incident management team to mitigate, or in cooperation with Sangamon County, we have instituted an incident management team to manage the emergency. To manage this emergency, because it's really bigger than, as I said before, it's bigger than the city of Springfield. It's really bigger than Sangamon County, but that's the logical place to start, because the public health department, they have those experts. They have those epidemiologists who are able to give good advice, sound advice to our responders and to the public. And their advice has been simple, that, you know, you want to maintain that 6 feet space, you want to cover your coughs, you want to sanitize your workspace. We have, through this incident management team, we have streamlined redundant efforts and taken steps to make sure that things aren't missed because other people may think that someone else is doing them already. So that's been the beauty of what we've accomplished very early on in this system, and that can grow and shrink as this incident does. So anytime you have an incident, be it large or small, it has to be managed in a way that communication goes up the channel and down the channel. That is the only way that you're able to make sure that things are getting checked off of the list that are important. So we start by problems. We start by identifying the problems. And that is the list is infinite at this point. But as we identify those problems, we then start to sort those problems out into different groups who can then, at the task level, begin to mitigate those problems or to get them crossed off of the list. And that's what we want to do. And that's what a good incident management will do. I think we have a good team in place. I think it is the most cooperative effort I've ever seen between the city and the county. And that is going to make this crisis more manageable. The flow of information will come out, and hopefully we will get through this together and we'll flatten that curve. And if the citizens take the steps to do their part, to not spread this to each other, and definitely not to our most vulnerable population, I think that we will get through this. But it's one of those emergencies that one entity can't solve by themselves. It really takes a group effort, and that's what we've got in place.
And when you mentioned the curve, my understanding is what's happening is as we have an escalation of cases, it will continue to peak, and then once it peaks and starts coming down like a bell and then flattening out, that's when things will ease up, or with regards to restrictions, or is that how that process would work?
Yes, that's my understanding as well. A lot of the restrictions, as you know, have come from the state level, and we really learn about them about the same time the public does. And we've reacted to those restrictions with our incident management team. But yes, when you start to get light at the end of the tunnel, that's when those restrictions should be lifted, and hopefully that's when we can look back and recognize at that point that through some difficult decisions at the state level and really the local level, we were the first group to restrict room sizes to 250 people. That was over and above what at the time even the state was recommending. So I commend the physicians that 2 weeks ago I didn't even know their name, and they've taken bold steps to try to get out in front of this and try to make people understand that this is serious. It's not a time for panic. It's a time to be diligent, and it's a time to take those additional steps to be conscious of what you are touching or who you are around. And if you keep people out of that 6 feet space and you don't cross-contaminate by touching the same hard surfaces and then touching your eyes, your nose, or your mouth, if you decon your area, that's what I've told our firefighters, is just decon your workspace. Make sure that you decontaminate and treat it really just like you would if somebody in your house had the flu. Is you put them in one part of the house and the rest of your house should smell like bleach, because that's the only way that you can keep that from contaminating others.
Well, great. We appreciate that. And when we're called to emergencies, the ones we call first usually is our police department. And we can't thank them each and every day. They've accepted the challenge. They go into unforeseen circumstances on a regular basis. And we can't thank them and their families enough, just as our fire department and our medical professionals that are helping us deal with this situation. And with that, we couldn't ask for a better chief than Chief Kenny Winslow. And if you'd provide an update on how you foresee things as they've progressed.
Well, thank you, Mayor. As of today, we've been able to maintain the same level of service to our community by instituting some changes as to how we deliver those services. Kind of like Chief Rainey said, what we're doing right now is we're rounding more of our calls to our teleserve officers, and we've increased the number of personnel assigned to those duties. If an officer is dispatched to a citizen's residence, you may receive a call from an officer prior to arrival so they can gather pertinent information via phone to limit the face time. Additionally, they may ask you to step outside and speak to them out there. If possible, they will try to maintain social distancing while limiting face contact. They may also be wearing gloves, or they may have a mask on, depending on what the call of the situation is. Additionally, we ask our citizens that if there is someone quarantined in your home or in isolation, that they please notify dispatch of that when they place the call. Officers have been issued the appropriate PPE or personal protective equipment. Let me go back there. Officers have been issued personal protective equipment kits, but there is a need for more, as Chief Rainey stated. We submitted a request to the Sangamon County Office of Emergency Management. We also have a need for additional hand sanitizer for our officers. And our Citizens Police Academy Alumni Association is currently organizing a donation effort for unused bottles. We have adjusted our work schedules as well as our workspaces. All large meetings and trainings have been canceled, and we are utilizing technology and social distancing when possible. We have limited access to our station, and we ask that citizens call prior to make sure that there is a need for them to come. We ask citizens to make appointments for routine meetings or to retrieve items from our evidence vault. If someone needs a crash report or a FOIA request, we ask that they access our website. We are trying to mitigate risk, but unfortunately in our profession, that is not always possible. We are preparing to adjust our level of response based upon the evolution of this pandemic and any additional tasks that may arise. Our number one priority is public safety and safety to our personnel while maintaining quality service. In order to do that, we need the public system. Start that over. Our number one priority is public safety and safety of our personnel while maintaining quality service. In order to do that, we need the assistance of the public by following the advice of our medical professionals and taking the appropriate precautions. This matter is a crisis that, let me start that over. Our number one priority is public safety and the safety of our personnel while maintaining quality service. In order to do that, we need the public's assistance by following the advice of our medical professionals and taking the appropriate precautions. This is a matter in crisis unlike anything we have seen in my lifetime, and it should be taken seriously. With that said, as far as the incident management team, I believe Chief Rainey summed it up very well. It is a team effort. This is much bigger than the city of Springfield. It's bigger than Sangamon County. What we are trying to do is to relay information to our surrounding jurisdictions, those donut hole jurisdictions. Every night I send an email to my donut hole communities, I should say, whether that's to Chief Ryan at Leland Grove, Chief Estel at Jerome, Chief Hyatt over at Grandview, Chief Weiss down in Sutherview, as well as Chief Foley out in Chatham. We try to communicate on what best practices are out there, what's going on. We're trying to forecast what the next 24-hour work cycle is going to look for us and the tasks that we have to get done. We know that this pandemic is ever evolving and it changes from moment to moment. It could be one way 1 hour, and then 15 minutes later it's another way. So we are also trying to keep our officers informed. And the city has put together a COVID-19 website that brings together all the resources from IDPH, Memorial Health Systems, HSHS, SIU Medicine, and it brings it all together, Sangamon County Department of Public Health, and brings it all together in one location so people can go there to find information. That's the website that I'm referring my officers to and my family and friends to. It's a way for everybody to keep up to date. But as far as everything else is going on, we're doing well. It's fluid, it's dynamic, it's constantly changing, but I'm confident in our abilities as a team, the incident management team that has been put together to solve this. And again, you know, everybody works very well together. There are problems that we might not be able to solve, but we'll try to mitigate them to the best of our abilities. We know this is a challenge unlike anything we have seen. So as we go forward, we'll keep you informed.
So thanks, Chief. And if you could, where would they send the information as far as someone wanted to make the donation with regards to sanitizers or what have you?
Yeah, our Citizens Police Academy Alumni Association is putting that plan together as we speak now. I believe it's going to be posted on social media, and we can go from there. I know that there's been a church already step up and provides some of that stuff for us. Again, it's not that we can't afford to buy it, it's just you can't find it anywhere. That's the issue that first responders are having, and that's why all personal protective equipment is being treated like gold right now, even if, not just for police and fire, but for our medical professions. Everybody is in need of this type of equipment, and we know that the manufacturers are working as quickly as they can to get that, but there is a need for that. And so, again, we're just trying to reach out and think beyond the box about how we can do it. We do have a supply right now. We do have some currently, but we know that we're going to need to replenish that. And, you know, the hope is that OEM will come through by being able to tap into maybe IEMA and some other resources they have to gather some of that personal protective equipment. But we're trying to think above and beyond for that right now.
And that's a good point you bring up, because what we're trying to do is, again, to do better today than we did yesterday. But with this changing dynamic, we have to think of new ways to do things, like the sanitizers. You know, we have ordered some hand dispensers throughout the building. If we have extra ones, what we'll do is probably refill our bottles using the typical dispenser. But we would ask the public for your help too. If you have ideas of how things could be handled more effectively, more efficiently, how we can communicate better, or anything of that nature, we'll always listen to you. And you just go to our website, springfield.il.us, and check out the information there. As the chief said, we have a coronavirus website, and we don't want to deluge you with information, but there's a lot of great information out there, coordinating with the medical community and other entities so you can have the most up-to-date information possible. So we appreciate all you will do to work with us so we can keep everybody safe, and we'll get through this together.